welcome to Truptwellness. This is Dr. Trupti and we are talking on the topic of Placenta Previa. In last episode, we already covered symptoms, classifications and precautions to be taken in low-lying placenta and Placenta Previa. Let's discuss more about this in today's episode, like who are at more risk of having Placenta Previa, what are the chances of vaginal birth with Placenta Previa, and what are the effects on the baby and the mother's health. If you are new to the channel, then please do subscribe. Keep supporting us, and thank you so much for making us reach 25k subscribers. We are a huge family now. Thank you so much for that. So who are at more risk of Placenta Previa, or who have the more chances to get affected by this condition? So the first one is multiparity, means if you are into second or third pregnancy, and also the women with higher maternal age or above 35 years. The incidence of this condition rises as per the advancing maternal age. It is 1 in 1500 women in the age group of 19 years or below that, and it is 1 in 100 women in the age group of 35 years or above. And so Ayurveda has defined the healthy childbearing age or the most fertile time of a woman's life from 16 to 25 years. Also, it is associated with the aging of vasculature of uterus. Due to this, the cells of the uterus goes into hypertrophy, means the cells tends to grow bigger and larger, due to which the chances or the possibility of the placenta enlargement and reaching it to the lower segment increases. The second one is history of previous C-section or cesarean section, and also other surgeries of uterus like myomectomy or hysterectomy. Now here in this also, doctor needs to assess three conditions. The first one is placenta accreta. If the patient had previous C-section and is dealing with Placenta Previa in current pregnancy along with the placenta on anterior side, then this placenta might enter deeply and firmly into this organ called uterus through that scar, and this condition is called as placenta accreta. The second one is placenta increta. If the placenta attaches itself more deeply into the muscle wall of the uterus, then it is called as placenta increta. And the third one is placenta percreta. In this condition, placenta grows through uterus, extending it to the nearby organs like bladder. At the time of natural delivery, the placenta detaches itself from the uterus during the third phase of labor once the child is out from the birth canal. But in this condition like Percreta or Accreta, the placenta is firmly attached into the uterine wall or the organ, so it gets very difficult to separate naturally. And also the attempt to remove or separate it will cause severe bleeding. The third one is twin pregnancies or multiple pregnancies. These conditions will have more risk of Placenta Previa due to the bigger surface of the placenta. And the fourth one is smoking. Smoking causes placental hypertrophy or enlargement of the cells of the placenta to compensate carbon monoxide induced hypoxemia. How can this condition affect the mother and baby's health? The first one is low birth weight in babies. If the bleeding episodes are recurrent, then obviously the nutrition going to the baby will get hampered, resulting in low birth weight and smaller babies. The second one is premature delivery. The bleeding of Placenta Previa increases the risk of PPROM, that is premature preterm rupture of membranes. This leads to premature labor, and this is the reason why doctors do not wait till full term or 40 weeks of your pregnancy in such conditions. This will increase the risk to babies as well as mother's life. Also, the mother can become unstable at any stage. In such cases, prenatal steroids like betamethasone or dexamethasone are given for the lung maturity of the baby in order to prevent the complications like breathing problem or lung infections post-delivery. Third one is hypovolemic shock. If the bleeding in natural delivery or the C-section is very high, then the mother may go into hypovolemic shock. In this condition, other organs do not get enough blood and oxygen. This is a life-threatening condition. Can I have a vaginal delivery with placenta previa? Yes, it is possible in the following conditions only. First one is if it is a type 1 or type 2 placenta previa with no active bleeding. Second one is your pregnancy should be below 37 weeks. Third one is the fetal heart sound should be good. Fourth one is you should be hemodynamically stable, means your hemoglobin level should be above 10 grams. And the fifth one is the CTG should be reactive, means the movements of the baby should be good enough. In such conditions, your doctor will go for induction of labor with the help of oxytocin or ARM, means artificial rupture of the membranes. And if the labor progresses with no bleeding, then you are good to go with the vaginal birth. In some cases of partial placenta previa, also your doctor may go with the natural delivery if there is the availability of blood transfusion, if the baby is small and the placenta is above 2 centimeters. But there is a big no in case of total placenta previa. Elective C-section after 36 or 37 weeks of pregnancy as per the patient's condition is the healthiest and safest option for both mother and baby's well-being. So this was all about today's episode. We hope this information was helpful. Knowledge always gives us the confidence to deal with the complications wisely, and also it will keep your baby away from the unnecessary stress. So let's meet with new topic in the next episode. Till then, stay happy, stay blessed. Thank you.